The cost of COVID is rising, so much so that some hospitals are starting to really feel the strain. KCTV5's Nathan Vickers joins us live now to tell us why the cost of treating patients is going up and why that's a problem for healthcare providers. Nathan?
Yeah, well, here in the Kansas City area, we've seen about a 16.5% increase in daily hospitalizations over the past couple of weeks. And of course, the vast majority of those patients are unvaccinated. And especially in rural areas, those costs can add up quickly. A surge in cases isn't specific to one area. Dave DILLON with the Missouri Hospital Association says healthcare providers across the state are experiencing the same spike.
What we're seeing is that the numbers are increasing, that in COVID positivity rates as well as hospitalizations.
But at the same time, hospital staffing has dropped, forcing providers to rely on more expensive staffing agencies that provide temporary help.
The smaller hospital in rural parts of the state is competing with the same talent pool as the biggest hospital in an urban part of the state. So the costs are the same, the talent's the same. It's just a matter of delivering it there. And that can get really costly very quickly.
Hospitals often have to eat that extra cost. It's a problem ANGY LITTREL has seen firsthand. She's the CEO of FITZGIBBON Hospital in Marshall, Missouri, which has been the largest provider of tests and vaccines in the area throughout the pandemic.
The impact the pandemic has had on the workforce has been an enormous burden on hospitals.
She says it's particularly hard to fill the specialist positions required to administer monoclonal antibodies, which they've been using more extensively over the past few months to treat severe cases in unvaccinated patients.
Our numbers that we are giving have grown substantially. In the last 14 days, we've probably given 75 monoclonal antibodies. We were doing historically 3 or 4 a day. We've done as many as 10 or 12 a day recently.
Hospitals across the state could face many difficulties over the next few months as they continue to carry a growing burden.
None of this happens easily. We all have to do our part to get it done. And moving back to normal means doing what you need to do to protect yourself.
There's a couple of other factors at play here, too. For one thing, the Missouri Hospital Association says there's also a spike in seasonal flu cases this year. That's creating more hospitalizations. And they're also seeing some pent-up demand for healthcare services. And so that's also pushing more people to go to the hospital for those services that they may have been putting off for the past couple of years. Reporting live, Nathan Vickers, KCTV5 News.